Imagine waking up from surgery feeling hesitant to take a deep breath because of the discomfort.
We were doing so well holding it in. Imagine.
I'm keeping this part in. I don't even put. Or consider someone struggling to take a deep breath from lung infection or other injuries. This can create further complications like pneumonia. Now picture a simple device that fits in your hand and is capable of helping you take those deep, easy breaths and avoid these dangerous complications. This device is the incentive spirometer. Today I will talk to you about this remarkable device and how its small yet powerful impact on the respiratory health. Whether you're recovering from surgery, dealing with a lung condition, or simply seeking to maintain strong lungs, the incentive spirometer is a game changer. According to Egan's Fundamentals of Respiratory Care, the incentive spirometer is categorized as a lung expansion therapy aiming to prevent or treat atelectasis, which is the collapse of lung tissue. It emphasizes that this therapy works by encouraging sustained maximal inspiration and mimics natural sighs or yawns, helping to reopen the alveoli. The device increases transpulmonary pressure and inspiratory volumes, which expands the lung tissues and improves oxygenation. It's especially critical in post-op patients when they are at high risks of lung complications. Post-op patients typically are in pain and do not like to get out of bed. And patients recovering from surgeries involving the chest and abdomen are at further risk as their lungs have collapsed typically during the surgery. Patients with chronic illnesses like COPD, where maintaining optimal lung function is essential, can also benefit from this device. It is the main preventative measure for pneumonia in a hospital setting, as atelectasis is the beginning onset of pneumonia. Egan's recommends that the patient performs 5 to 10 breaths per session, aiming for a target inspiratory volume appropriate to their condition and capabilities. Each session is repeated hourly while the patient is awake to maximize effectiveness. Each patient has their own goals based on their age and height, which we use to determine proper lung volumes. There's contraindications for the incentive spirometer when patients are uncooperative or not at the mental status to do it. And there's also those unable to use this device due to neuromuscular disorders like Guillain-Barré's or myasthenia gravis. Those with neuromuscular disorders need to be monitored closely. And also with using the incentive spirometer, you need to ensure proper use to prevent hyperventilation or fatigue. Consistent use results in improved lung functions, volumes, decreased incidence of post-op pneumonia, and better mobilization of secretions. The IS is an underused and undervalued tool in the hospital setting.